Hi everyone, I'm Meyer, and we are presenting the status of nutritional indicators and risk factors among children and adolescents in San Carlos, Costa Rica. The three of us participated in the ACM Field Studies program in Costa Rica last spring, so spring of 2011. Just as an introduction of ourselves, again, as we were presented, I am Jess. I go to Colorado College. I am a public health and biology major with a Spanish minor, so the program provided a perfect opportunity for me to do research as well as practice my language.
And I'm Maggie Swift. I go to Macalester College. I'm in my senior semester. I'm a biology major and Hispanic studies minor, and I'm hoping after school to go into medicine either as a physician's assistant or possibly a doctor.
I'm Souza, and I also go to Macalester College. I'm a senior as well, and I'm a psychology and sociology double major, and so this program really helped me explore my interest in those areas and also in public health.
So obesity has become a prominent and dangerous aspect in the health field on an international level. It's kind of all over the news in a bunch of different studies, and is definitely a prominent issue. Officially, obesity is defined in a bunch of different parameters. The two we focused on were BMI, or body mass index, as well as abdominal circumference. Obesity is associated with many different health factors and health risks, and so it has been declared a worldwide epidemic. Officially, the US declared an obesity epidemic in 2009. Obesity can be associated with many different detrimental health risks, including cardiovascular disease, coronary heart disease, and many other mental issues as well. And so those problems associated with obesity can also cause numerous risks in health costs and an increase for both the individual and the nation. In some studies, it's been observed that up to 36% increase in health costs can be occurring for an obese individual, and then overall on a national level that can cause a 23% increase for any individual just trying to get your average health care. Additionally, children are a specific target within this epidemic. Targeting obesity in an adolescent age as opposed to once an individual gets older is really important in both education and in the association between an obese child and obesity in adulthood. So we decided to investigate this situation within Costa Rica. First of all, we were there, so it was a good location to be studying it. Also, there weren't that many studies that have been done previously. Most of the obesity prevalence studies had been done on Latin America as a whole, with kind of just national numbers. Also, one specific study that had been targeted at Costa Rica had only been done in urban areas, and so we were looking more in rural places. And that one study had observed a 34.5% rate of overweight adolescents in urban areas in Costa Rica and 26.2% of obese adolescents. So this really suggested that this was a problem that needed further investigation. Also, we had an advisor who was a physician in the public health provision system within Costa Rica, the CCSS, and so working with him, we collaborated to create a study to analyze the obesity rate within the San Carlos region. The CCSS provides a really wonderful opportunity for a country to look at an issue as a whole because of the connection between the public health system and the public education system. So we worked through the schools and to provide more information to that system so that they could start creating prevention measures. So the objectives of our study officially were to measure the height, weight, and abdominal circumference of public school students ages 4 through 18. We were hoping to identify the risk factors for childhood and adolescent obesity, including time spent watching TV, using the computer, playing video games, physical activity, and birth weight. These risk factors we based off other studies we had read of common risk factors and looking to see how those played out within the target population we were looking at. And then finally, we hope to analyze the data we obtained to determine if there is a relationship between the hypothesized risk factors and the prevalence of obesity in overweight adolescents in the rural Costa Rica region.
So as Jess mentioned, the only major study done regarding obesity in Costa Rica had been done in a very urban area. So we decided to go visit a pretty urban, rural area in Costa Rica called San Carlos. It's where the gigantic star is in kind of the northeast corner. And I was in Aguasarcas, Maggie was in Pital, and Jess was in Venecia. And we chose to do these 3 different locations so we can get a more equal study population. And so Aguasarcas was the largest study site where I was collecting research of about 20,000 people. Pital had about 12,000 and Venecia only had about 8,000. So we were in the same general region but working in different towns. And all the towns were primarily organized around agriculture and ranching. And the size of the school districts varied, but we all tried to visit as many schools as we could. So our study population, as you could probably guess, included school children in the districts where we were working. The inclusion factors were just that kids were willing to participate and went to the schools that we visited. If they were under 12 years old, they needed to bring in a set form home to their parents and have it signed. If they were over 12, they could sign it themselves. This is a little bit different than the criteria that we see in the US, where we think of 18 usually as kind of that benchmark age. But since we were working with Freddie, who, our advisor, he had done a lot of research and he kind of assured us that this was the age that was appropriate in Costa Rica. We had a few exclusion factors that we had to exclude a few different participants due to some students were pregnant and also some were over 18 years old, and also if we were missing some data. So in terms of methodology, we started our project by gaining approval from the superintendent of all schools in the San Carlos region, and then he directed us to the more direct supervisors of each individual school district where we would be working. It was really important to gain his approval so that the principals and the teachers in these school districts knew what we were doing and had an idea about our project and had approved that we were allowed to do it. And then we would generally visit schools over the course of 2 different types of visits. We'd go first and we would distribute the survey that we had made regarding their habits doing physical exercise and also how much time they spent watching TV, playing video games, etc. And then we would come back later in the week and collect these surveys and collect anthropometric data, so measurements of their height, weight, abdominal circumference. And to kind of standardize our collection methods, we would have all kids in picture number 1 take off their shoes and any heavy clothing that they were wearing. Number 2, we would weigh them, and we were all using the same measurement instruments, so we all had the same scale to make sure that we were really standardizing all of our methods. We would also take their height using a right angle, and then we would also take their abdominal circumference using the iliac crest as kind of the uppermost reference point for that measurement. And we, as you can see from the height and the weight, we were finding their BMI, and then from measuring their stomachs, we were getting their abdominal circumference. So we were getting 2 different measurements of their health status. And then finally, for our statistical analysis, we were using frequency analysis to find out the prevalence of obesity, overweight, normal weight, and underweight in this region. And we also analyzed in terms of male, female, and also age division. And then we used regression analysis to see if there were any relationships between some of the hypothesized risk factors that we talked about before and the health status of these children.
So, between the 3 of us, we were able to get data from 2,580 students, which we were very proud of. As you can see, there were a few more girls that participated than boys, which was pretty consistent with the population distribution of the country, so that was good to see. As Chloe mentioned, we did end up having to exclude several students for various reasons, but it was a small enough number that it wasn't really significant in terms of our overall research. And the overall return rate just relates to how many surveys we got back from the students based on, out of how many we gave out total. So 70 was very high. I think we had a little variation between the 3 of us, but for the most part it was around there. So this is one of our frequency analyses. This shows all the students that we worked with divided into the 4 different nutritional categories. So we've got the underweight, normal, overweight, and obese. And as you can see, most of the students do fall into the normal range for the nutritional status, which is good. That's what we want to see. But we were surprised to see that about 25% of the population falls above that. So that means they're either overweight or obese. We defined, well, this graph is based on BMI, which I don't know how familiar everybody is with BMI, but it's just a ratio of height to weight. I don't know if we talked about that. So that's what we were using for this one. And we got similar results for abdominal circumference, but there was a little bit of difference in there. And for overweight, that was defined as being between the 85th and 95th percentile for their age range, and then for obesity, that was above the 95th percentile. So I think the most interesting thing that we gained from this sort of analysis, we all sort of did individual ones and divided them by age group, which we don't have pictured here, but we found between the 3 of us that the most common, or the highest prevalence of obesity was seen in children between 7 and 12 years of age. For me, it was 7 to 9, and for Chloe and Jess, they found the 10 to 12 age range had the highest prevalence, which is really interesting, and we think makes a lot of sense because that's the age when kids are going through sort of a big growth spurt and putting on weight before they reach adolescence and start to grow taller and develop more muscle mass. So after we did just those frequency analyses, we did the regression analysis, and we were able to find, we did find a significant relationship between all of the risk factors that we had measured with the surveys and the obesity and overweight based on the BMI and abdominal circumference. So as you would imagine, we found a positive relationship between screen time, which is, again, spending time in front of TV or a computer or a video game. So a positive relationship between that and obesity. So the more time a kid spends sitting in front of the TV, the more likely they are to have a higher BMI or a higher abdominal circumference. Also, as you might imagine, we found a negative relationship with physical activity. So the more physical activity the kids do, the less likely they are to be in that overweight or obese category. And then we, in our research, found a positive relationship with birth weight. So that means that we asked all the kids what their birth weight was on the survey, and we found that generally the kids who had the higher birth weights were more likely to have a higher BMI and abdominal circumference. And as Jess sort of mentioned, there have been previous studies that have looked into that, but as I'm going to talk about in a minute, we think that this area still merits a little bit of further research. So just to sort of relate this back to some studies that were done before ours, we did find that the prevalence was sort of in line with what has been seen in the US, maybe a little bit lower. I think, I don't remember what you said, but there was one study I know that we worked with that had a prevalence of about 17% for obesity. And so obviously we were a little bit lower than that, but still pretty close. And we did see a lower, there was the study that was already done in Costa Rica that you mentioned, and our rates were obviously lower than that. We think there are a few reasons for that. First of all, that study that we were taking that statistic from was only carried out in San Jose, which is the capital city, so it's a really urban environment. Kids aren't walking to school, they're usually taking the bus or driving in cars. They're not out helping their parents on their farms or in the fields, which is what we saw a lot in San Carlos. So we think that has a big effect. And then also that study only worked with kids in the 10 to 12 age range. So obviously what we saw in our study was that there was a lot more obesity there, so that makes sense that they had a little bit of a higher rate than we did. In terms of the risk factors, we did see all of our results were consistent with studies that had been previously done on these risk factors in obesity. We think it's interesting, a lot of older research has obviously shown that there's this positive, this negative relationship, positive relationship between screen time and obesity. So the more screen time the kids do or participate in, the generally more likely they are to be in the obese category. And there's sort of a debate between whether some people think that that's due to the decrease of physical activity that goes along with just sort of sitting in front of a TV or a computer and not moving around and being active. Then there's another sort of camp of people who think that that has to do with the increased caloric intake that a lot of times goes along with watching TV and mindless eating that kids will sometimes do when they're just sitting in front of the TV or the computer. So we think that more research into sort of the specific reasons of why screen time influences BMI and abdominal circumference would be really important. For physical activity, we obviously saw that the more physical activity the kids participated in, the lower their BMIs were in general. And we think, again, in previous research, we saw that there has been a lot of success with implementing school programs to promote physical activity. And we think that this could be really important just because then there's sort of a standardized regimen of physical activity that all the kids are participating in, and they're sort of required to do it rather than leaving it up to them to do on their own. We also think it's important to address why we use both BMI and abdominal circumference. A lot of times studies will just use one or the other to measure these nutritional statuses, but we thought it was important to use both because they are measuring sort of different things. So because BMI is this ratio of height and weight, it doesn't always take into account body composition, so a lot of times really muscular kids who have a high weight, for maybe a shorter stature it seems like they're in the overweight or obese category, but they're really not. And then with abdominal circumference, that doesn't take into account the body distribution, especially body fat distribution. Since you're just measuring right around the waist, you can't see where if their fat's distributed somewhere else. So that's why we thought it was important to use both of those. And luckily we did find generally the same results with both measures. And obviously, because we were doing a large-scale research project, we ran into a lot of constraints. The main ones were if we had administrators, this was never really a problem for me, but I know sometimes we had administrators and teachers who weren't super on board with what we were doing. And so it wasn't that anyone ever stopped us, they just weren't always very helpful with distributing the surveys and collecting them. I think another main constraint was that since we were in really rural areas, the schools were really spread out. So sometimes we would have to, there wasn't always public transportation, there wasn't usually public transportation, so I was able to sort of hitch a lot of rides with people that worked in the schools and teachers and principals, and a lot of times we would have to walk for several hours to get to schools and to get back. So that, just in terms of time and energy was a drain, and we didn't have time to get to maybe as many schools as we would want to. And sometimes we did have issues with participation. Kids wouldn't want to be measured in front of their classmates, but for the most part, that wasn't really a big issue, I don't think. So, in conclusion, we would say that based on our data, there is an alarmingly high rate of obesity in this area of Costa Rica. In the US, like Jess said, we've sort of declared an obesity epidemic with a 17% rate of obesity, and Costa Rica is really, in this area, really is not far behind that with a 13% rate. So we think that it's definitely something that needs to be addressed. If we could give recommendations for intervention, we would say that they should include both an increase in physical activity and a decrease in screen time. So like I was saying before, we think something that would be really important and really helpful is to implement if the public schools could implement some sort of program where there was like a very specific physical activity schedule that all the kids had to participate in. I don't know how many schools we went to. We went to a lot of schools, and I never saw two schools with the same sort of physical activity classes. Sometimes they didn't have them at all. Sometimes they would have them once a week. Sometimes they would have them every day. So if there was some way to make this more consistent and make it at a sort of a higher standard so that the kids were getting the recommended amount of physical activity, we think that would be helpful. Also, as I mentioned, more studies need to be done with birth weight. Previous research has shown, some research has shown that high birth weight is related to a higher BMI, and some have shown that a low birth weight is generally the idea is that if you're born in a low birth weight, your parents will try to compensate for that by feeding you a lot as a child. Then you develop habits that lead to a higher rate of obesity as an adult. People have also shown in studies that a high birth weight is associated with it. So we found a higher birth weight was associated with a higher BMI, but we think that there's definitely room for future research there. And last but not least, we would love to keep working on this, obviously, if we could. And we think there's a lot of opportunity for future studies, something that we would have liked to look into, but just weren't able to because of time and just materials and constraints, was nutrition. So like a lot of times at the schools, we would see there wasn't really always a cafeteria where they had like a sort of healthy lunch for the kids. They were just these stands that would be selling candy and snacks and a lot of fried foods and a lot of really sugary things. So we think it would be really interesting to look into nutrition both in the schools and then at home, just how that sort of changed from the traditional diet and how this is contributing to obesity, because obviously it is. And in closing, we would like to thank our advisors, Freddie and Diana Ulate. They were a father and daughter duo. They're both doctors, and I think, like Jess sort of said, that Freddie is really involved in the public health of the country. He's a pediatrician and a surgeon, I believe, and also works for the public health sector, so he's very involved. The ACM staff was obviously really helpful, and then everybody involved in the schools and the school districts that we worked in. Everyone was really welcoming. We didn't have any trouble for the most part, getting into schools. The kids were all really excited to help and learn about what we were doing, and so we felt like that was very helpful. Thank you.